In its first budget, the Ford government proposed merging and modernizing public health units as a way to find efficiencies and save taxpayer dollars. It was not immediately clear what it all meant, but as more details emerged, it's a move that's provoked substantial pushback. Robin Martin is parliamentary assistant to the Minister of Health and Long-Term Care and the Progressive Conservative MPP for Eglinton-Lawrence, and she joins us now to explain the government's approach on this. Welcome back.
Thank you.
Nice to have you in that chair. Let's just put up the, Sheldon, can we do this? Can we put up these pie charts here? This is what the Toronto Public Health 2019 budget looks like. Two charts, and for people listening on podcast, I'll just describe them here. The pie chart on the left has got $151 million of provincial funding and $43 million of City of Toronto funding, 75-25 in a ratio. The new charts that they're putting forward say that the new funding formula has the provincial allocation essentially cut in half to $86 million. The $43 million from the city stays the same, but of course it leaves a $65 million unfunded obligation compared to the last time. So first question is, do you dispute any of these numbers?
Yes, I don't dispute the existing numbers, what it exists right now, the $151 million and the $43 million from the city. But the other numbers that the city's come up with, we have disputed all the way along. We don't agree with those numbers at all. We're talking about a very modest realignment of services in public health, and the amount of funding that we would be giving, for example, next year would be $114 million.
You believe that the correct number is not $86 million from the province, but $114 million?
Yes.
All right, well, which still leaves tens of millions of dollars of unfunded at the moment, obligations, right?
It's $33 million, and we don't consider them unfunded obligations. We're asking the city to look at the programs, to prioritize, and to make the best choices they can. We're all working hard to get the maximum value we can for taxpayer dollars, especially in every area, but especially in healthcare. It's very important, we believe that they can find some efficiencies and maybe some things that we can do better and deliver better.
What is the justification from going from a 75-25 cost-sharing arrangement to a 50-50 cost-sharing arrangement?
Well, under the Health Protection and Promotion Act, municipalities are responsible to provide public health services. In the past, it was a 50-50 cost share arrangement. More recently, there has been a 75-25 cost share arrangement, but we feel that it makes sense to make it more of a 50-50 arrangement going forward. It's an important thing that municipalities have a say in what they're providing with the services, and we want to make sure that everybody is looking at how they maximize how to spend those health dollars.
Let's use your number just for argument's sake, $33 million. You know, it's I mean, on a $11 billion budget in the City of Toronto, it's not that much money, but it still has got to be found. And I'm wondering how much of a heads up you gave them to let them know that you now have to find $33 million you didn't have to find before.
So it's actually less than 1/4% of the City of Toronto's budget, which is $13.5 billion, I believe. So it's a very small amount of money. It's 0.24. It's 2/1000th of the budget. So it's a very small amount of money.
But it's something they didn't think they had to find.
Sure, but we know that there are lots of places in the budget of the City of Toronto, like all governments, where there are inefficiencies, where they're spending money. And frankly, the Toronto Public Health has been actually running a surplus for several years, including, I think, in 2011, they had a $12 million surplus. So there's money sitting there that is available that is not being spent right now. And then, of course, there is money that is being spent but perhaps not on priority public health services.
For example?
For example, they have they commissioned a study to ban energy drinks. Interesting, but not really a core public health service.
How much did they spend on that?
I have no idea. That's just an example.
Can't be much.
And still, it's something that shows that the city is not just funding core public health services out of the Toronto Public Health. Another example is they commissioned a study for health and safety impacts of reimagining Yonge Street, which is about bike lanes. Again, not core public health services, not what the province is giving the money for in public health.
So when we hear officials from the City of Toronto say things like Student nutrition programs are going to be at risk. Vaccinations are going to be at risk. Food safety inspections are going to be at risk. You're not buying?
No. These are core public services, core public health services, which will continue to be provided as they always have been. We're funding $114 million for Toronto Public Health, and all we're asking is that they focus on the priorities and that they review every program like we've been doing to make sure that they're spending the money in the best possible way. And we've offered to work with them to do this, to look at these programs with them and find if there are better ways to deliver some of these programs. And that's part of our modernization efforts. You know, we can find some savings perhaps in digitization, we can find some savings in perhaps making sure that the right level of government is doing the right things, but they will continue to provide priority public health services.
Can you, this is not a smart aleck question, okay? It really is not. But can you understand from their point of view when Premier Ford sort of surprises them with I'm cutting your city council in half and not really consulting you ahead of time, and I'm making these cuts to your budget without giving you a heads up on that. And there have been other things, obviously, along the way where the province made a decision and, you know, taking the subway away, for example. Can you understand why the city might not think that your offer of help is all that helpful?
I don't know, Steve. We're trying to work with the city. We're not taking the subway away.
Well, you're uploading ownership of the subway.
Which we ran on, and we did run on making sure we got maximum value for every tax dollar. We're working very hard to review every program and make sure we protect the things that matter most, and those things are healthcare and education, both of which we're putting more money into in this budget. We meet regularly with municipalities at AMO conferences, and we have monthly regular meetings with AMO, and we discuss all issues.
That's the Association of Municipalities of Ontario.
That's right, and we discuss all issues. So all the ministers come and discuss issues that impact municipalities. So we're really trying to do our best to work with our municipal partners, and I certainly hope Toronto is going to be one of the partners that you know we can work with on these things. We also have, technical working groups that we're setting up on our healthcare transformation, and we hope that the City of Toronto will be participating in those.
Well, to that end, you are consolidating local health units, going from 35 to 10, with an expected savings, I guess, of $200 million in reduced funding over the next couple of years. What's the thinking behind that?
Well, it's partly this modernization and realignment of public health services to make things more rational. Right now we have 35 public health units, we have 35 medical officers of health, we have 35 boards of health, and we have, I think, 5 different governance models for those. None of that is based on anything, you know, that was rationally set out. We're trying to realign and prioritize our healthcare services, you know, going forward. And we think we have a better idea to have a model with 10 regional health, public health entities and 10 medical officers of health to go with it, or boards of health, and we have one governance model that we're going to propose. So part of this is just trying to make our healthcare system work in the best possible way for every Ontarian. And, you know, we're not leaving anything alone. We're looking at everything to make sure that we do things better. That's what they elected us, the people of Toronto and Ontario elected us for.
Do you think there will be any reduction in anything important if $200 million provincial dollars less are now not going to be going to those local areas?
No, we don't. We think that they'll be able to provide the public health services, the core public health services that everybody relies on. We're doing all this, you know, with that in mind, that we will continue to provide our public health services in the way that is going to be the best delivered for people across the province. And I think that it's important that people realize that. We are actually putting $1.3 billion more into healthcare this year. So all the money that we save in this initiative goes back into healthcare. And we're just making sure that the spending is as rational as possible and getting the best bang for the buck.
I hear you. I just want to put that in perspective, though. What is it?
$1.3 billion more.
$1.3 billion more on a $60 billion budget is what percentage? I'm not fabulous at math off the top of my head, but
me either. Don't challenge me.
I'm betting it's not healthcare inflation. Like, I'm betting it's a very modest increase and doesn't cover healthcare inflation, the increased usage on the system, et cetera, et cetera, et cetera. That's my hunch.
Well, and you know that we were faced with a $15 billion deficit when we took power. We have a $338 billion debt. The former government was spending $40 million every day which it did not have. And what we're trying to do is get our fiscal house in order. That's what people elected us to do. And to get things on track while protecting the things that matter most, like healthcare. And that's what we're doing.
Can I pick up on that? Because my hunch is people get that, right? There was a big deficit when you took over, and there is a big debt that has to be paid off eventually. Can the government not simply come out and say, look, I know you're all unhappy with the cuts that we're making, but here's our financial reality, and we're just going to have to get by with less. Can you not say that?
Well, I think we've been saying to people we're trying to prioritize the things that matter most, and we're doing that. So we're effectively saying something very similar, I think.
Well, I keep hearing government ministers say, "Don't worry, nothing like everything that's important we're hanging on to."
Well, that's right. We're protecting the things that matter most, and I think we are.
But there's certainly a difference of opinion about what's important, isn't there?
Well, I think, with the Toronto public health thing, they're suggesting that if they don't continue funding everything exactly the same way it has been last year, that there'll be a crisis and children will starve. I mean,
Actually, they said people would die.
Yes.
That's what they said.
They did. Outrage, indignation, and really overblown rhetoric over something which is very minimal. I think even Marcus G. and Matt Gurney, who wrote a blog, I think, on the agenda, had articles which sort of said, you've got to be crazy if you think that every dollar that Toronto Public Health spends is spent to maximum impact and maximum value. Of course, there are things in there that maybe are things that they've done for a while that they could look at and do better. We're putting $90 million into seniors' dental care. That's a new announcement in public health that we've made and a new commitment to public health. Mm-hmm. It's taking up a responsibility that really was the responsibility of municipal public health units to provide, and the province is taking that on. Okay,
let me read a little snippet here of a letter that was written from the chair of the Canadian Public Health Association. I'm sure you've seen this. This was to Christine Elliott, the Minister of Health, and Premier Ford. And it includes 320 plus public health professionals signing on. And it says, your government's proposed cuts put these cost-effective and cost-saving programs and services in jeopardy. They can be expected to have the unintended negative consequence of increasing the pressure on your province's acute healthcare system, as people with health conditions that could have been prevented will be presenting themselves in emergency rooms and doctors' offices throughout the province. Let me use the metaphor that I know people in public health like to use, which is, you can solve problems either upstream or downstream, right? You can solve the problems before they happen at a cheaper cost, or you can wait for what to hit the fan and have to clean up the pollution in the river downstream, which is going to cost twice as much. Now, that's an argument that I think is an empirically provable argument. So does your approach not fly in the face of that empirically provable argument?
Absolutely not, Steve. I mean, we think that public health is very important, and the core services that public health provides will continue, and we value those services, and we think they're very important. So we vehemently agree with all of these public health professionals. All we're saying is that every government, just like we have done, should look through their programs as often as possible and say, is this program still serving, the people to the maximum value? Is it the right level of government delivering the service? Is it delivered in the right way? Are there things that we can do to improve it? And are there some things we're doing that maybe could be better done by another level of government?
These are all very sensible questions.
Yeah.
And if, in your offer to help, as you offered earlier, if when you, whoever you are from the province, sit down with whoever it is from the cities and go through line by line, number by number, looking at all the programs, and are you open to the possibility that they actually do need all the money they were getting from you before, and are you open to restoring it if they make the case?
Well, I mean, I don't want to prejudge what the technical working groups, will decide together. I don't want to prejudge those conversations, but I would say we're doing this all the while expecting that it will not impact core public health services. And we say that because we're not asking for much of a change. As I said, it's 0.24 of 1% of the city's budget. So if that's the case, there is no reason that they can't find that kind of money in their $13.5 billion budget, or even within their public health budget itself.
That's the Toronto number, but of course it's a different number for other municipalities all around the province.
Absolutely, and we're working with those municipalities, and we're having discussions with them, but we fully anticipate that the core public health services will be able to be funded in the new model.
That was probably not the thinking of the hundreds, if not thousands, of people who've been demonstrating at Queen's Park against these cuts. Do you think, political question here, do you think you underestimated the opposition from around the province to people seeing their public health care budgets cut?
Well, I was in the legislature, I suppose, when the one day of some demonstration about healthcare happened. I think most of the demonstrations have been something else. So I didn't see the demonstration. My understanding, though, from the media coverage I saw was that people were out there for any number of reasons, not just health. So people were out there to protest anything that they thought was something that they didn't like. So I don't think that is any reflection of whether or not this is a good idea. I think most taxpayers do not believe that everything the City of Toronto does gets maximum value for every dollar they spend, or that they can't review those programs and improve upon service delivery. I think most people expect that they can, and that there are some things that they can find, and we've given a few examples to do that.
You know the Mayor of Toronto.
I do. He's a very nice guy.
John Tory.
I like him very much.
He's not nutty about this, I got to tell you. Now, shall we play this clip? Here he is. This is the Mayor of Toronto, John Tory, on Metro Morning, the CBC radio program last week. Sheldon, if you would.
I don't think there's a single progressive Conservative MPP in Toronto who got elected on the commitment that, or even on the notion that they would acquiesce to cutbacks in childcare, in public health, in gasoline tax, which is used to help keep transit going. And so we're going to go and ask them that question. Are they going to stand up? Because we sure are as a city council, and I am as the mayor. Are they going to stand up on this and say inside their own government that it is time to take a hard second look at these things? These are not efficiencies. These are dramatic cutbacks, sometimes more harshly imposed on Toronto, which leave the city government with only two alternatives, especially when they're done retroactively in the middle of the budget year, which is to cut services or to raise taxes.
Okay, bunch of things to unpack there. You're one of the Toronto MPPs he's asking to take a second look at these things.
Yes, I am.
And?
I would say that I am standing up. There's only one taxpayer. I am standing up for the people who elected me. They elected me and a PC government to deal with the fiscal mess that we're in and to get Ontario back on track. And that's exactly what we're doing. All we're asking Mayor Tory to do and other city councillors is to focus on the things that matter most, to review their programs and make sure that they're getting maximum value for tax dollars. And nobody believes that they are. And it's not just them, it's a thing every government needs to do once in a while. Certainly, it's not been done provincially for many years, and that's why we're very focused on doing it now. And this kind of modern progressive thinking and reviewing of programs in government, I think should be going on all the time.
He says that you've done this in the midst of a budget year in which you've left him no alternative but to either cut programs or raise taxes in order to fill that gap of, in this case, $33 million as you've outlined it. Do you see any other course besides cutting services or raising taxes?
Yes, I think they can look at what they're funding and say, you know what, we really don't need to do a study to ban energy drinks, for example, because even if we found in our study that we should ban energy drinks, we don't have the power to actually ban energy drinks. That's something somebody else can do, and it's not a core public health service that we're spending money on.
Some of this is about sticking to your knitting then, I guess.
I think so.
Right?
I think so. Look, that's what we give them money for. We give them money to fund core public health service delivery, which everybody agrees is important. And, we're going to fund them $114 million this year. And really, it's up to them to choose what they want to do with that small pressure of 0.24 of 1% of their budget.
Want to give them some advice on how they should make it up?
Well, I think we're willing to work with them, as I said. I wouldn't presume to advise them, but I think we could look at things together and see if there are some of these programs, I've mentioned a few, that I think are maybe outside of what they're doing, or things that maybe could be delivered better and more efficiently. And I think there's got to be lots of opportunities there. There was a recent report of the City of Toronto's own independent auditor, who identified lots of other, wasteful spending, and there have been years of identification of spending, things that could be corrected that they haven't done. So
now, I presume you, as a good Conservative, are not urging the city to raise taxes.
No, I'm not urging the city to raise taxes. I don't think it'll be necessary. This is such a small amount, really, and as we're committed to our $114 million worth of funding, and we're committed to work with them. So I don't see that as the necessary way to go.
You made an announcement.
Again, it's
right.
kind of overinflated rhetoric. Sturm und Drang, as it were.
I didn't know you were bilingual. Maybe that's trilingual. A little German there. Okay. Last question here. You made an announcement yesterday about mental health. And, you know, some people are going to be asking, how does it make sense to, on the one hand, put forward an announcement of many millions of dollars in the promotion of better mental health, and on the other hand, take away money from public health budgets that might actually be helpful towards better mental health?
We have made a historic commitment, as you know, to mental health and addictions. It's $3.8 billion over 10 years. And
half of which is federal.
Half of which is federal, and half of which comes from us. So that's $1.9 billion from each level of government. And it's important. Everybody realizes, you know, mental health is health, and we have to do better. So we had a great announcement, and it's Mental Health Week. So we're going to be rolling out announcements this week, and we think it's a very important area. We are increasing the funding generally to healthcare. As I've said, we put $1.3 billion more into healthcare, which includes $384 million for hospitals. It includes $267 million for home and community services, and $174 million for mental health, which the minister has announced will be ongoing funding, so it won't change. So the organizations that receive it can rely on that and plan with it. And so this is exactly what we're doing. We're taking any money we save and putting it back into healthcare and putting it into the priorities that matter most for patients.
That's Robin Martin. She's the MPP for Eglinton-Lawrence and the Parliamentary Assistant to the Minister of Health and Long-Term Care, and we are grateful that you spared some time for us to come into TVO tonight.
My pleasure.
Thank
you, Steve.
The Agenda with Steve Bacon is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.